NCSBN Nursing Questions and Answers NCLEX Practice Test. Question 1. Which discharge instruction should the nurse make sure to include for a client with chronic pancreatitis? Option A. Make sure to eat a low-fat, high-fiber diet. Option B. Try to reduce smoking cigarettes to half a pack per day. Option C. Limit alcohol intake to 1 drink a day. Option D. Take the prescribed pancreatic enzymes on an empty stomach. The correct answer is option A. Make sure to eat a low-fat, high-fiber diet. 1. Question 2. The nurse is assisting in developing a plan of care for a postoperative client following a radical left mastectomy. Which nursing problem should be the priority for this client? Option A. Risk of infection of the surgical site. Option B. Anxiety related to the cancer diagnosis. Option C. Acute pain related to the surgery. Option D. Impaired left arm circulation, lymphedema. The correct answer is option C. Acute pain related to the surgery. 3. Question 3. A client comes to the community health clinic with symptoms of gonorrhea. Which intervention should the nurse implement first? Option A. Discuss the risk of infertility with the client. Option B. Collect a urethral swab from the client. Option C. Instruct the client to notify past sexual partners. Option D. Obtain information about the client's recent sexual encounters. The correct answer is option D. Obtain information about the client's recent sexual encounters. 4. Question 4. The nurse is assisting with developing a plan of care for a client with benign prostatic hyperplasia. Which nursing intervention should the nurse include for this client? Select all that apply. Limit caffeinated and alcoholic beverages. Calculate accurate intake and output. Void every. Option A. 2. Option B. Hours to empty the bladder. Catheterize as needed for post-void residual urine. Monitor for bladder distension. The correct answer is option N. Limit caffeine. Catheterize as needed. Monitor. Question 5. A nurse is caring for a client with continuous bladder irrigation, CBI, following a transurethral resection of the prostate. Which finding would indicate the need for the nurse to increase the flow of the CBI? Option A. Bladder spasms. Option B. Pain at the catheter insertion site. Option C. Temperature of 99.8 degrees Fahrenheit. Option D. Blood clots in the catheter tubing. The correct answer is option D. Blood clots in the catheter tubing. 4. Question 6. A 68-year-old, postmenopausal, female client has been prescribed tamoxifen for breast cancer with bone metastases. The nurse should reinforce teaching about which potential adverse drug effect. Option A. Stroke-like symptoms. Option B. Seizures. Option C. Symptoms of hypocalcemia. Option D. Insomnia. The correct answer is option A. Stroke-like symptoms. 1. Tamoxifen is an anti-neoplastic drug, commonly prescribed for clients with breast cancer or for clients who are at high risk for developing breast cancer. The most common adverse drug effects, AIDS, are hot flashes, fluid retention, vaginal discharge, nausea, vomiting and menstrual irregularities. In women with bone metastases, tamoxifen may cause transient hypercalcemia. Because of its estrogen agonist actions, tamoxifen poses a small risk of thromboembolic events, including deep vein thrombosis, pulmonary embolism and stroke. Question 7. The school nurse is teaching a group of teenagers about the prevention of sexually transmitted infections, STIs. Which statement by one of the students indicates an understanding of the teaching? Option A. Wearing a condom will eliminate any risk of contracting an STI. Option B. There are vaccines available that will prevent the majority of STIs. Option C. Being on birth control will prevent getting an STI. Option D. Having multiple sexual partners puts me at a higher risk for an STI. The correct answer is option D. Having multiple sexual partners puts me at a higher risk for an STI. 4. Question 8. The nurse is reinforcing teaching with a client who has recurrent kidney stones. Which statement by the client would indicate that further teaching is needed? Option A. I will follow a low-calcium diet and avoid dairy products. Option B. I will contact my healthcare provider if I am having difficulty urinating. Option C. I will monitor the color of my urine. Option D. I will make sure I drink plenty of water throughout the day. The correct answer is option A. I will follow a low-calcium diet and avoid dairy products. 1. Question 9. A client with benign prostatic hypertrophy has been prescribed tamsulosin. Which statement by the nurse describes how this medication works? Option A. This drug will eliminate your nocturia. Option B. This medication will improve the flow of urine. Option C. Your libido will increase with this medication. Option D. This medication will shrink your enlarged prostate gland. The correct answer is option B. This medication will improve the flow of urine. 2. Question 10. The nurse in the outpatient clinic is assisting in the admission of a client scheduled for a prostatectomy this morning. Which statement by the client should be of greatest concern to the nurse? Option A. I am feeling nervous about the procedure. Option B. I have not had anything to eat since 9 p.m. last night. Option C. I have had an allergic reaction to an antibiotic before. Option D. I have not had to urinate since yesterday evening. The correct answer is option D. I have not had to urinate since yesterday evening. 4. Question 11. The nurse in the emergency department is admitting a client with a reduced level of consciousness due to severe hypothyroidism. Which intervention should the nurse implement first? Option A. Implement warming blankets as indicated. Option B. Orient the patient to person, time, and place. Option C. Monitor O2 saturation and provide supplemental oxygen. Option D. Administer propranolol as prescribed. The correct answer is option C. Monitor O2 saturation and provide supplemental oxygen. 3. Question 12. The nurse is caring for a client who has type 1 diabetes mellitus. Upon entering the room, the nurse notes the client has rapid, deep respirations, and is lethargic and difficult to arouse. What should the nurse do first? Option A. Check the client's blood sugar. Option B. Administer glucagon per protocol. Option C. Review the client's insulin pump settings. Option D. Review when the last dose of insulin was given. The correct answer is option A. Check the client's blood sugar. 1. Question 13. The nurse is reinforcing education for a client with type 2 diabetes mellitus who is being discharged home. Which statement by the client would require clarification from the nurse? Option A. At home, I should check my blood sugar before meals and at bedtime. Option B. It is important to increase my physical activity gradually. Option C. I will make sure to have an eye exam every 5 years. Option D. When I administer my insulin, I will rotate injection sites. The correct answer is option C. I will make sure to have an eye exam every 5 years. 3 eye exams should be performed annually for diabetic clients due to the risk of diabetic retinopathy. Question 14. The nurse is caring for a client who was admitted for hyperglycemic hyperosmolar state, HHS. Which clinical finding would support this diagnosis? Option A. Blood sugar 600 mg/dl. Option B. Positive urine ketones. Option C. Deep, rapid breathing pattern. Option D. Serum pH level 7.35. The correct answer is option A. Blood sugar 600 mg/dl. 1. Question 15. A client diagnosed with hypoparathyroidism would be most likely to display which of the following symptoms? Option A. Pruritus. Option B. Flank pain. Option C. Decreased reflexes. Option D. Polydipsia. The correct answer is option A. Pruritus. 1. Question 16. The nurse is caring for a client with diabetes who was admitted for intractable vomiting. The nurse notes that the client's skin is cool to the touch, and the fingerstick blood sugar result is 55 mg/dl. What intervention should the nurse implement first? Option A. Administer glucagon. Option B. Recheck the blood sugar in 15 minutes. Option C. Offer the client a warm blanket. Option D. Administer an antiemetic. The correct answer is option A. Administer glucagon. 1. Question 17. The nurse is reviewing the plan of care for a client with acute adrenocortical insufficiency. Which intervention should be a priority for this client? Option A. Administration of potassium supplements. Option B. Electrocardiogram monitoring. Option C. Implementation of a low-sodium diet. Option D. Administration of insulin. The correct answer is option B. Electrocardiogram monitoring. 2.